Hello again, everyone. It's Adam Capek again here with the next in our series of talks called Why Are We All Stuck Indoors? And for this one, I thought we could just talk about who actually works in the NHS. Clearly, we're all talking about the NHS at the moment. We know that it's coming under strain, and we know that the staff are coming under strain with the coronavirus outbreak. But who actually are these people? There's clearly some people that you might automatically associate with working in the NHS. So like myself, like doctors, like nurses, maybe like midwives. But there's a huge range of other people that work in the NHS who I think it is important we also acknowledge and we also recognise as playing an absolutely vital role in patient care. Now, every Thursday evening at the moment, there's this, I suppose we can call it an event, this thing going on called Clap for Our Carers. You may well have been involved in it. You almost certainly have heard it in the street if you haven't been out there yourself. But people are coming out of their front doors for a couple of minutes at 8 p.m. on a Thursday night, and they are applauding. They're applauding for this country's carers, this country's key workers. Now, that's not just the NHS, obviously. That's a whole range of other people. So the police, the fire brigade, teachers, people who work on the front line in shops, or people who collect the bins in the streets, all of these people who are putting themselves out there. But clearly there's a big focus on those NHS workers. But if we're going to be standing at our doorsteps applauding for these people, it's really important we recognise who they actually are. Now, it's to my shame on that subject, really, that about a year ago I went to an NHS Scotland careers event. This was an event for school pupils to come to the event and to meet people working in different roles in the NHS. I was there as one of the medical representatives, and my mind was absolutely blown by how many potential roles there are in the NHS. Now, this is an organisation I've worked for about 15 years already. And even then, I didn't have an awareness of just how many things, how many particular jobs you can do. And we were given this document at that event, this document called A Guide to NHS Scotland Careers. And within it, even before they start talking about the specific careers, there's some information just at the front where they say that whoever you are, whatever job you're performing in the NHS, NHS Scotland would expect certain criteria from you. And those criteria, they're all quite sensible, but really they are worth thinking about. So the first thing they want from people is they want care and compassion. So whatever role you're fulfilling, if you're working in the NHS, you are in a caring profession. And sometimes from a medical sense, there's nothing we can do to help someone. Sometimes medicines, surgical options, they've all run out. But offering care and compassion to a patient and to their family, sometimes that's the most important thing we can possibly do. We need to show dignity and respect. We obviously need to treat people in a dignified way, and we need to treat them in a way that would want our own families or ourselves to be treated. And that's not always easy. Sometimes patients can be challenging to look after. Now, it may well be their medical problems that are causing that, but whatever that is, we have to treat them with dignity and respect. And we also need to be open and honest and responsible. We need to be responsible for our actions. We need to not be acting above our capabilities. But if mistakes are made, we need to be open and honest. We need to be honest with ourselves. We need to be honest with our colleagues. And we need to be honest with the public when those mistakes are made, because that's the only way that the NHS can continue to improve. And finally, whatever we're doing, we need to do it with quality and we need to do it with teamwork. Now, there are certain jobs in the NHS that you may associate with being high profile or being, even in inverted commas, life-saving. But none of those jobs are possible without the whole team of other people around them working just as hard as that individual. Remember that a chain is only as strong as its weakest link. And in this chain of the NHS, if there's one link there that's not performing to its full potential, then the quality patient care. Now, how are we going to talk about all these different jobs? I could just list the chapters in that book, but to be honest, you can get it online, so there's no point me doing that. Why don't we talk about a fictional patient? Let's talk about this guy. Let's call him Jack. Now, Jack's been stuck indoors like the rest of us, but he is lucky enough to have a garden, and he's even more lucky because he's got a trampoline in his garden. But unfortunately, he's had a bad fall and he's hurt his leg. Now, his parents are worried and they've rung for an ambulance. Let's think about Jack's journey from that point of hurting his leg on the trampoline to going through potentially to hospital, to potentially needing an operation, to then getting discharged. Who are all of the people that are key players in his care? And it starts on the end of a phone. There's got to be someone to answer those emergency phones, someone who knows the appropriate actions to take and the appropriate advice to give. And then when they arrange an ambulance to come out, that paramedic crew, the ambulance technicians, they're going to come out, they're going to assess Jack, they're going to decide how significant his injuries are and whether that needs hospital care. And then if the need be, they will take him to hospital with the blue lights running if it's an emergency, or with the blue lights not running if they can take a bit more time. So even before he's got to hospital, he's already in contact with NHS workers. And when he gets to the front door of the hospital, when he gets to the accident and emergency, who's there to greet him? Well, the first people that they may well be involved with are the reception staff. So not the people actively giving the patient care, but the people who are vital to the whole running of that department. And then when he's all checked in there, he may well come across a healthcare support worker. They might get him settled in. They might take some observations from him and then refer him on to one of the nursing staff, potentially one of the triage nurses. Now, the job of the triage nurses is to assess the severity of someone's medical problems and then work out, prioritize who needs care first and most urgently. And once that's done, then one of the medical staff can see him, one of the doctors, potentially one of the junior doctors, so that's a doctor who's fairly recently qualified, or one of the senior doctors, one of the consultants who's been qualified for a longer period of time. So again, he's seeing a whole range of people within the accident and emergency. And clearly he's got a leg problem, so he's going to need an x-ray. Now, I've chosen an x-ray of a leg that's not broken here because I don't want anyone fainting away behind their computers. But let's have a look at this x-ray. So that's his knee, ankles down here. This is the leg, the lower leg from the front. This is it from the side. This big thick bone, that's your tibia, that's your thick shin bone. This is the fibula, just the narrow one just alongside it. So anyway, this is Jack's leg x-ray. Who takes that picture? Who takes that x-ray? Well, it's a radiographer. So again, that's another health professional who has had a training in taking x-ray images. And if there's bloods taken from Jack, well, they need to be processed. They need to be analysed in the lab. So all these blood tubes, they'll get sent to the lab. And those people working in there, the lab technicians, the lab scientists, they will analyse them. They can run them through special machines. They can look at them under a microscope. They will process the results, send them back to the clinical teams looking after Jack, and Jack's team can then make decisions about his care from that. Now, Jack's going to have to go to the ward. He is going to need an operation, but he's going to go to the ward first. How's he going to get there? He clearly can't walk because he's got a bad leg. Someone's going to have to push a wheelchair, and there come the hospital porters. Now, the porters don't just move patients around, they move equipment around. If we need blood in an emergency in the operating theatre or on the labour ward, they will bring us that blood in an emergency. So the porters are vital to the smooth running of the hospital. And as an aside, if you ever get lost in a hospital, and I've worked in the Glasgow Royal for about 10 years and I still sometimes get lost, if you find a porter, they will always know how to get you to where you want to be. Now he's going to get to the ward. So this looks like a fairly typical ward setup. Who's on the ward? Well, perhaps sitting at the desk over here, there might well be one of the ward clerks or clerkesses. They're responsible for the administrative side of the ward, making sure that's all running smoothly. You may well have one of the senior nursing staff there, one of the charge nurses, who is ultimately the ward manager responsible for all of the care in that ward. There will be other healthcare support workers. There'll be other members of the nursing staff. There'll be junior ward doctors, and it's their job to pick up problems early in those patients and then potentially refer that on to the specialists, to the senior doctors who will come and do ward rounds on a daily basis and plan the patient care from there. And once he's been on the ward, he can then come through for his operation. Who's in the operating theatre? Let's think about that now. Well, there'll be someone like myself. There'll be an anaesthetist looking after him. There will certainly be an anaesthetic assistant as well. That's often a specialist member of the nursing team who can help the anaesthetist. There will be surgeons. There will be surgical scrub nurses. So they're nurses specially trained in supporting surgeons to do operations. There'll be more nursing staff running the floor, so making sure that everything else in the operating theatre is working fine. There'll be more healthcare support workers. There are also a professional group called the Operating Department Practitioners, or we call them the ODPs for short. They're essentially nursing staff, but whose entire training is based on working in the operating theatre. Now, he may well need other x-rays during his procedure, so the radiographers would come in. So we're not working alone in the operating theatre. We're actually bringing in all the other specialties, if we need them, to help and assist us. And let's look at this operating theatre environment. Well, there's some great big operating lights there. What happens if there's a problem with the electricity supply? Well, there's electricians that work in the NHS. What happens if there's a problem with these gas supplies that are going into the back of this oxygen delivering anaesthetic machine? Well, there's engineering within the NHS. All of these roles, all of these people who might not be directly looking after patients, but who have to be doing their jobs for us to be able to deliver quality patient care. And let's look at our anaesthetic machine. This is obviously something close to my heart. You can see these here. That's where we use stick the anaesthetic gases. So that's what keeps you asleep. We've got some monitors. We've got a ventilator here. It's like a giant bellows. If you think about it, basically like the sort of pump that you'd use to pump up a bike tire. It does exactly the same job, but it does it with a patient's lungs. But what if there's a problem with this machine? Well, there are specialists in medical physics, and they look after all of the equipment, all of the monitors, everything that is in use in the hospital. It's their job to keep it running smoothly. Now, he's had his leg fixed, but he's going to need a plaster cast. He might well need it on for six weeks or so. Whose job is it to make sure that that's on appropriately? Because you certainly don't want a problematic plaster cast for 6 weeks. Well, there's another professional group, they're Plaster Technicians, and it's their job to make sure that all these things are done properly. Back to the ward, he's not going to go straight home. He's going to need some rehabilitation. Well, who's there? This is a physiotherapist, so they're going to look after his physical rehabilitation. There might well also be occupational therapists there. Now, their job is really to look at people's day-to-day lives, work out what disabilities or what problems they might be having, and then find ways, find tools, find fixes to overcome those problems to allow people to continue functioning in their own homes. And what about food on the ward? Well, there's a whole catering team in the hospital. There's people in the kitchens making the food. There's people delivering the food to the wards. There's also, let's remember, there's dietitians. There's specialists in working out what diets people should be having to help them come to terms with their medical problems as well as possible. And another group of staff who are just as important, well, there's the domestic staff. The hospital has to be clean. Clearly that's important at the moment while we're all thinking about bugs and coronavirus, but any time, day or night, 365 days a year, there are a team of people making sure that the hospitals are spotless to keep patients safe. And finally, when it's time for Jack to go home, well, he's going to need some medicines, maybe some painkillers to take home with him. Who is keeping those prescriptions? Who's keeping those medicines safe? It's the pharmacy team. So there are pharmacists within the NHS. You might think of private pharmacists, perhaps working in Boots or perhaps working in Lloyd's Pharmacy or other standalone pharmacies. But there's a whole team of pharmacists also working in the hospitals and in the NHS to keep our patients safe. Now, that's all good and well. That's all the roles. That's all the people that you may see. You may see them in the hospital corridors. You may be looked after by them. But behind the scenes, there's also a huge number of other people who are all doing their jobs and without whom none of us could do our jobs. So remember that the NHS is a huge organisation. It's a great big business. And a big business needs managers, and it needs people looking after the finances. So in the background, in the office blocks, there are all these people working away. There are also secretaries, typists, making sure that letters go between the hospital and between the GP surgeries. So again, all these people that you as a patient, even me as a doctor on a day-to-day basis, might not see, but without whom none of us could look after patients. And I've not even touched on A lot of the other extended roles in the NHS, these may not be hospital-based, but they're still key workers for the health of the population. So dentists, opticians, well, clearly in the hospital we might have midwifery staff, but they also work in the community. And let's think about psychology support as well. And that's not just psychology support for the patients, but at the moment, in a time when a lot of the NHS staff are under huge strain and huge pressure, the psychology services are also looking after the staff. Everybody playing a key role so that we can continue to work on the front line, looking after patients. I guess what I'm saying really is, on Thursday evenings, these incredibly heartwarming events are happening. People are coming out onto their doorsteps. They're applauding for a couple of minutes. They're applauding for all these carers. As I say, not just NHS workers, all the other careers, all the other people working on the front line. But in terms of the NHS, let's make sure we're not out there just clapping for the people with a public face, the doctors, the nurses. Let's make sure we're clapping for everybody, because ultimately this whole team is there working together to provide quality patient care. And that is what the NHS is really all about. So I hope that's been interesting. I hope it's given you some insight into the vast teams that we're working with in the NHS. I hope you're keeping well, and I'll be back soon with another talk. Thank you for listening.